Okay, so our group is group number A, Amber Pacheco, Laureent Gonzalez, and Amauri Ortiz. Our article was called Interruption of Nursing Activities, Contribution to Patient and Professional Safety. In the introduction, we saw that safety is an essential role in nursing, that we all know that by now. Most errors are due to the system failure or intervening condition. The number of interruption ranges from 0.4 to 13.9 per hour, which to me seems like a lot. Main sources of interruptions were telephones, pagers, staff members, patients, and lack of supply. Interruptions compromise workflow and impairs the nurse's concentration and decision-making progress. Studies identified that 88.9 to 90% of the interruptions resulted in negative consequences such as delay in treatment and loss of concentration.
Methods. Exploratory and observational research was conducted on 25 unit nurses. The unit nurses were from adult critical care, pediatric critical care, pediatric surgical care, and adult surgical care. The study was conducted at a university hospital in Sao Paulo, Brazil. The university's hospital capacity was 700 beds. Data was collected by one single observer, totaling to 150 hours of observation. Each nurse was observed individually, and the study did not interfere with the clinical practice. The results. The average age of the nurses who were observed were on average of 28 years old. The number of patients per nurse was an average of 5 patients per nurse. 2,295 activities were performed by the nurses observed, and 15.3 activities per hour was conducted by each nurse. A total of 1,180 interruptions were observed, 55.1% of them being lack of supply. Comparing the number of interruptions per hour between pediatric and adult, where pediatric had 8.6 interruptions per hour and adult had 7.3 interruptions per hour. A difference was seen between pediatric and adult, but did not see a difference between critical and surgical care.
Discussion. Direct patient care activities require more time from the nurses. Nurses work in an unpredictable, complex, nonlinear, noisy environment. In addition, researchers show that these professionals are frequently interrupted during the course of their activities. The current study found higher number of interruptions caused by the nursing staff, physicians, and medical residents.
Amber, it stayed on the residents, the last one.
Okay, give me 1 second. Sorry guys, technical difficulties.
That happens when you are live.
Can you see it now?
No.
No, but it's still in the last one.
A ver. What about now?
Nope.
Okay, 1 second.
Conclusions. Interruptions were identified in 719 cases, the 31.2%, out of 2,295 activities, resulting in 1 interruption in every 3 executed tasks. On average, it was observed that some activities were interrupted more than once, totaling 1,180 interruptions, or 7.9 interruptions per hour. The interruptions lasted an average of 10 seconds, which was long enough to divert nurses' attention, lose concentration. This resulted in a higher of the nurses making a mistake. This study provided subsidies that identify factors with potential that compromise patient safety based on the current knowledge in the field.
And these are
the reference.
Thank you, guys.
Thank you.